And could you please also let us know you have been questioning to one of the dignitaries by naming them, please? Yes, and please to introduce yourself also, ma'am. I'm really sorry.
I'm Rajma. I would like to ask the question to Dr. Pratap Reddy. Good morning, doctor. How are you? It's been ages since we've met. I just wanted to know how early could this cancer cell be detected before there are any clinical signs of it. I mean, how early can this cancer cells be detected with a blood test before there are any clinical signs? Secondly, at what age is this test advisable? You said that the test can be done on any women, but at what age is this test advisable? Thirdly, health care services is the first line of assurance of prevention. But in a country like ours, where healthcare services are very minimal, how do you expect a woman to go for this kind of a test? How affordable is this?
The age is, recognized age is 40 years according to the data.
You're saying that the blood test has to be done at age 40?
Yeah, age 40.
Okay, 40 and above.
But I think all of us must remember, I remember way back in 1974, when I mentioned American cardiology, that Indians get heart attack at the age of 35. They didn't believe it, because when I came back from US, I had 8 patients in 30s in heart attack. They didn't believe it. They said, no, they're Indians, don't know the date of birth. I said, forget, they not only know the date of birth, they know the star at which they are born. In 1980, 6 doctors in US didn't get up from the duty rooms. All of them were Indians. Then help broke out saying, Indians get heart attack very early. So I think it's nice. This easy check. Even for me, I did not recognize earlier. Even on stage 0, there's 80% possibility that it can become. So the age group that commonly are affected are people, women, over the age group of 40. But I still think that even, the late 30s, they should get a checkup done. Because if it can pick up at stage 0 and want it with probably the biggest gift that you can give for the family. Because it is, as I said, it's not an expense. The investigation is not an expense. It is an investment into family happiness. To find out that there is no cancer, or is there cancer in a lady, say 40-year-old or 45-year-old, or 38-year-old, it is protected.
Yeah, I wanted to know how early you could detect this before there are any clinical signs. I mean, is there any possibility of, the blood sample actually taking
Yeah,
the
thank
symptoms?
you for the question. Adding to what sir has already, though the guidelines do say the screening has to start at 40 years, but what is recommended is if there is a family history of cancers, or if you see the risk factors associated with breast cancer, which include early menarche, that is when the periods start early for a girl, and also late menopause, or patients who are using hormone replacement therapy. In these patients for a long period, it is always advisable that you don't stick to that magic 40. It's always advisable that if these risk factors are there, then we might start our annual screening earlier on. So these are, but then the guidelines have to have some kind of cutoff, and that is where 40 years have been identified. As far as your second question, ma'am, could you please repeat the second question?
How early it can be detected before there are any clinical signs?
Yeah, so Dr. Bhandari had alluded to mammography picking up when the lump is about 2 to 3 mm. So in our trials we have found that this picks up even before the standard of care modality. So DCIS is a very early stage 0 of breast cancer, wherein there is no invasion beyond the basement membrane. At that point, if you are picking it up, it is pretty early. So we cannot give a timeline in terms of days or months, but it's always admissible. It's a continuous process. It is not like today I have got it tested. So this test essentially looks at a person's status of cancer at that point in time when the sample has been collected. So it's always an ongoing process, and annual screening is what is recommended. But if you have a higher risk, it's always recommended that you start up earlier.
Just to answer your question on the cost, this is Dinesh Mamania, and the reach. Currently, through the Apollo 24/7 platform, digitally a person can access and fix an appointment. He can also access it through over 75 of our hospitals, across our diagnostic chain, across our home care services, and also through the network of pharmacies, and all our partnered managed hospitals in India and abroad. This test costs over about close to $1,000 in the West. We are fortunate enough that looking at the social economic class and the need of a lot of people in a country like ours, that we are planning to offer this with Datar Genetics at a very low price to show that it reaches over a large number of people. So expect that in less than 1/10 of it at just 6,000 rupees. And that's the price point which we looked at. So a question again comes in India of a large number of people who may not be able to access them. There are very wide government schemes which today only provide treatment. And when I mentioned earlier, can we get it notifiable? It will be also good to know the various central government and state government schemes, if they could include screening as part of the package. And then we'll be happy to participate in those programs to ensure that it's spread across the country, across multiple central government programs and state government programs. Thank you.
Thank you so much. Just one more question, if you don't mind. Normally in a mammogram, 20 to 30% of tumors are missed. I know you said 99% of tumors are identified in the blood test. But is there any possibility of that 1% chance of the tumors getting missed?
I think Dr. Bandari would be a more apt person. It's something that he goes through on a daily basis.
See, whenever we order a test, there will be 2-3 tests ordered together. Easy check, mammogram, and if the suspicion is high, for example, if the family history of breast cancer is there, then even a BRCA1 and BRCA2 genetic test will be done. So in between all these tests, 3-4 of the tests, the chances are likely of missing any cancer is extremely unusual.
Hi, this is Swati from Times of India. I'm here. So I want to ask, anybody who can answer this question. So is this test only developed and recommended for women, or even men can take this test? Because there are breast cancer cases in men as well. And I'll ask my next question.
Yeah, so breast cancer, as we know, it is commonest in women. Not that men would not get breast cancer, but it is a very low incidence. And therefore, utilizing this test for screening of men's cancers rather than other commoner cancers would not probably make sense, especially in our country. And there's nothing like they should not get it done. The technology works for both men and women. But then that would not be the standard of care. Eventually, we're not foreseeing this being into the guidelines of men because you have other cancers which are common in men.
And second thing I wanted to ask is this 40 years of age that you're talking about, is it like mandatory that only women above that will be able to take this test?
Not at all.
Or anybody can? And it's not prescription based, is it?
No, it is not restricted to 40 years, as I told you. If there is a risk, or even otherwise if you would like to, but a doctor's prescription is what is needed.
Okay, it's required to be prescribed. Okay, thanks.
Can I ask one more question, if you don't mind? You said I'm sorry, I just lost my thought and I remember that all back.
Any further questions?
Hello. That 40,000 individuals, that's are from urban or rural? 40,000 individuals studied that from trials. That from urban or rural?
So it is a cohort which covers both urban and rural. So it is not specific to the urban strata alone. No, this is an international trial, but a significant proportion of these individuals are from India. Yeah, around 85 to 90%.
What period? The trials?
So it is it's a trial which has run over 3 years, from 2019 to 2021, and the publications are already there in the public domain.
How many countries the volunteers were?
3 countries.
Can you just
Dominantly it was
India?
India.
India, and what are the other 2 countries?
Yes.
No, what are the other 2 countries?
So India, Europe, and few patients from US as well. I would call them individuals, not patients.
Yeah, correct. And Europe, any specific countries?
I'm sorry, I didn't get you.
Any specific countries from Europe? How many?
Yeah, so I would call it UK, not because most of them are from London.
Got it.
Mr. Datar had spoken about using this test for other cancers as well. How soon are we going to, have this breakthrough for the other cancers? And I just have one doubt. There are circulating cells in the bloodstream which have broken up from the tumor cells. So how would that, impact the study? I mean, the blood cell study, the cancer cell study.
Precisely, that is the principle on which this test is based. So, a tumor, a malignancy, cancerous tumor, the tumor cells, the circulating tumor cells would be shed into the circulation, and these are picked up in the blood by special technology. Now, whether the other cancers, so it's not just restricted to breast cancers. Yes, we do have a test called EasyCheck 360, which looks at 30 cancers. Predominantly, these are the commoner epithelial cancers like cervix, colon, lung, and there's a list which we could talk about later, because this meeting is about the US FDA breakthrough designation test. We are not alluding to that, but that is already available, and the regulatory submissions are in process.
Hello, madam. I have a question for you, madam. This test you are telling me, madam, this 5 ml blood is drawn from the woman and to detect the breast cancer. And how is it going to detect only is a breast cancer or any other cancer in the body, madam?
So, yes, anything else?
That 5 ml blood is going to detect only breast cancer in a woman or any other cancer is she having, like leukemia or any other cancer also it will detect, madam?
So, EasyCheck breast is specific to breast cancers. So, we're looking at adenocarcinoma. So, there's a subtype called ductal carcinoma, which is the commonest form of breast cancer, which is picked up, and these constitute about 95% of the breast cancers. So on the EasyCheck breast, obviously because we are running only biomarkers for breast cancer, we can pick up only breast cancers. There are other tests which are looking at other organ-specific markers. But yes, your second question, whether this covers leukemia, it doesn't. So this is looking at solid tumors, and we can give you a list of all that. That's what I said. We will restrict our discussion today because to EasyCheck breast, because this is what we are talking about.
Madam, is it the first of its kind in India or is already prevalent in?
So this is the first of its kind worldwide to get a US FDA breakthrough designation.
Madam, authenticity of the test, madam, how are you going to do the authenticity of the test?
So that is the extensive trial that we have just shown. So the sensitivity, specificity and accuracy, this is what shows how successful it is in a given trial. So we do not say offhand. This is a formal trial which is there in the WHO database.
It's applicable for men also, madam?
Yes, there is a separate test for men. As one of the guests here had asked, can this test be done for males? There is no restriction that it should not be done for males. It can be done in males, but since breast cancer is of very low incidence in males, we do not look at that. So the emphasis is on women getting it screened for breast cancer.
Just a clarification. How soon are the results available? Is it instant or?
No, it is not. It's instant one. It's about 7 to 10 days.
And are the approvals given by the Indian government as well to conduct these tests?
In India, there is no specific approval required. It is the reports are required to be NABL accredited from an NABL accredited lab, which our lab is accredited.
And how many labs do you actually intend setting up?
Yeah.
Is there any particular specific
across the Apollo network,
Yeah.
as I mentioned earlier.
Okay.
Just to add to what Rajan said, you have the highest approving authority called the US FDA,
Yeah.
which has given an approval to it. And like mentioned earlier, you're getting the same test which is being given at the London Oncology Clinic for breast cancer, or at Boston, or at the Cancer Foundation, or in any other country where the burden out of the death of cancer is so low, but still they have adopted it. What we have taken as a leapfrogging measure today is to provide it to India. This is a very unique, first-time global, I would say, certification of a stamp of approval of an US FDA approval for an Indian company for a very specific test, which has got almost between stage 0 to later stages, moving from 80 to 99% accuracy. That to me is a very remarkable achievement, and that itself puts a stamp of approval above anything else.
Thank you.
I want to ask a couple more questions. One is, are you recommending that this test be done first and then this be corroborated with your mammograms, or you are looking at this as a confirmatory test to your other screening methods? So that is one question, and other is, what if there is some